So my name is Aishwarya, and I'm here on behalf of the Canadian Clinical Practice Guideline and Neurotrauma Care Pathways projects. And my supervisor is Judy Gargaro, and our project lead is Dr. Mark Bailey. Next slide, please. So before we begin, I would like to do a short land acknowledgement. So we acknowledge the sacred land on which the University Health Network operates. For thousands of years, it has been the traditional territory of the Huron-Wendat, the Haudenosaunee, and most recently, the Mississaugas of the Credit River. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee Confederacy and the Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. Today, the meeting place of Toronto is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work and learn on this territory. We recognize the challenges and discrimination that can exist in the healthcare system towards persons with Indigenous background. As system planners, it is our responsibility to identify and implement mechanisms to provide equitable and culturally sensitive care. Next slide, please. So the key objectives for today's presentation are to, number one, understand the process of the ongoing development of the Canadian TBI guideline, as well as the ideal care pathways. Number two, to discuss key contributions made by people with lived experience of brain injury. And number three, to discuss the guideline and pathways websites, as well as our next steps moving forward. Next slide, please. So to get everybody thinking about the topic, I'd like to ask everyone a question. So feel free to, if you are able to drop answers in the chat. So how many people do you think have a concussion or a moderate to severe traumatic brain injury every year in Ontario? So an approximate number of what you might think the answer is. Okay, so we can jump right into the answer. I'm seeing 55% of the population. Okay. Next slide, please. We can jump to the answer. So it is a number, not a percentage, but it is a large number for sure. So 170,160 people in Ontario every year sustain a brain injury. So this is made up of individuals who sustain a concussion, a complex mild TBI, and a moderate severe TBI, with the majority of individuals having sustained a concussion. So you can see the breakdown over there on your screen. Next slide, please. I have another question for you. So what percentage of people get access to rehabilitation after sustaining a moderate to severe TBI? So approximately what percentage of all the individuals who have sustained a TBI do you think get access to rehabilitation? Once again, feel free to drop any guesses in the chat. So I see less than 10%. That's a pretty good guess. Next slide, please. So as you can see, it's only 17.82% of individuals get access to inpatient rehab for their brain injury within 12 months after sustaining the brain injury. So to break this down a little further, around 5.29% of individuals get access to general rehabilitation, 8.72% get access to specialized rehabilitation, and 3.81% get access to neurospecialized rehabilitation. So as you can see, these numbers are pretty low. The percentages are also quite low. And I hope that gets you thinking about the state of rehabilitation and care. Next slide, please. And I have one last question before we jump into the presentation. So what is the average wait time for a bed in a specialized brain injury residential facility in Ontario? So how long do you think people are waiting to access a bed in a specialized facility? Once again, feel free to drop your guesses in the chat. Over 1 year? Definitely over 1 year, that's correct. Next slide, please. So it's a lot more than 1 year. It's 5 to 15 years, in fact, which is a very long time. So we have about 3 people waiting for each available bed in specialized brain injury residential facilities. We have approximately 249 We have 249 beds in Ontario and 0 available or vacant beds right now. And there are about 813 people waiting for those 249 beds. So as you can see, it's a very long wait list, and this is an issue that needs to be addressed. So moving to our next slide, please. So what does all of this tell us, all of this data, all of this information? It tells us that the system needs to improve. So that's the kind of work that the Canadian Clinical Practice Guideline and the Neurotrauma Care Pathways projects are doing. So what we are trying to do with the work that we are engaged in is talking about what should happen. So what kind of care needs to occur, who should do it, which healthcare stakeholders and healthcare professionals should be involved at what stages, why it should be done. So why is it important? And what is the purpose of this kind of work? And where it should be done. So whether it's in a hospital, in inpatient rehab, outpatient rehab, all of this information is what we are working with and what we are engaging in. Next slide, please. Also, I do see some questions in the chat. I will get to them at the end of the presentation, but thank you for dropping your questions there. So to introduce our work to you, the Canadian TBI Guideline was designed to provide evidence-based recommendations for the rehabilitation of adults having sustained a moderate to severe TBI. So the most important benefit of clinical practice guidelines are their potential to improve both the quality and the consistency of care provided by healthcare professionals. And their beneficial effects, however, are dependent on several factors. So they're dependent on a rigorous guideline development process that incorporates the best evidence available. And they are also dependent on the successful implementation of the resulting recommendations and associated tools. So not only is the development of the guideline important, but the way in which you implement it and apply it is also very important. So both of these components go hand in hand. Our other project, which is the Neurotrauma Care Pathways project, is funded separately by the Ministry of Health to develop evidence-based ideal care pathways for concussion, moderate to severe brain injury, and traumatic spinal cord injury. Next slide, please. So over here, we have what an ideal care pathway looks like. Don't worry about it being too small. We will zoom in the next slide. But this shows you the ideal care pathway for moderate to severe traumatic brain injury. So you have the 4 care stages at the top: pre-acute, acute, interprofessional specialized rehab, and community. So the stages through which an individual goes through in their care journey. And then underneath each of these stages, you can see several building blocks. So those are the components that should exist in an ideal setting under each care stage. So Section 1 of the Canadian TBI Guideline informed the creation of this ideal care pathway, and Section 2 forms the content of the building blocks of care, so all of those little boxes underneath each care stage. The ideal care pathways correspondingly inform the Canadian TBI Guideline by identifying gaps. So when the building blocks of care are created or being updated, we are able to see where we need to develop more recommendations to be a part of the TBI Guideline. So this demonstrates the bidirectional relationship between our two projects. Next slide, please. So over here, we've zoomed in on the community stage, and you can see some of the components that go into the community stage. And what I want to highlight for you is that all of these services and care that needs to occur under each stage, some of them begin way before you even enter the community. So for instance, the equity considerations need to be taken across the care.
Can anyone hear me? I see that Aishwarya is frozen. Or maybe it's me who's frozen.
No, I can't hear anything either.
Okay, thank you. But obviously you can hear me.
Yes, I can hear you.
Okay, that's good. So hopefully she'll just come back in. Sorry about that. This is part of the joy of Zoom.
It happens.
It happens, yeah. Thanks. Well, I think that wait list is no surprise to anyone, but when you see the numbers, it's so upsetting, right? That basically we have a quarter of the beds that are needed.
Are you able to get a message to her to let her know that we can't hear her?
She's back, yay.
So sorry, I don't know what happened, but
No
I
worries.
off for a second. Thank you all for being patient with me. Just a second. Just going to pull up everything again. Perfect. Okay. So sorry about that. Back to where we were. I'm not sure where we cut off. Could you please just let me know what the last thing was that I spoke about? I'm sorry, you're muted.
We're trying to improve both the quality and the consistency of care provided by healthcare professionals.
Amazing. Thank you so
Thank
much for
you.
that. Yeah, so as I was saying, equity considerations need to be at the forefront of care across all the care stages. Next. And then you can see here, a lot of the boxes start at the acute care stage. So things like ongoing education of healthcare professionals and people with lived experience, the transfer and interprofessional care coordination, community follow-up, peer support, all of these components need to begin at the acute care stage and carry on through the rehab stage and into the community. Next. And then you can see a lot of these components also start at the rehab stage. So you have things like in-person and virtual assessment and management of symptoms, as well as specialized navigation support for individuals with lived experience and their family members. So these components need to begin at the rehabilitation stage and then move into that transition into the community. Next slide, please. So moving into the core of today's presentation, the purpose of our work was to meaningfully engage individuals with lived experience of brain injury in the update process and implementation of the Canadian TBI Guideline and the ideal care pathways. So it's important to remember that as a user group, individuals with lived experience are integral to developing topics to be included in the guideline, developing recommendations where the research evidence might be poor, developing effective strategies to educate the community and healthcare professionals, and also in identifying gaps in the healthcare system. So the goal is to see people with lived experience and healthcare stakeholders as equal partners in research who can use their lived experience and expertise to influence research to be more patient-centered, be more relevant, and be more useful. So early and continued involvement of people with lived experience in clinical practice guideline development can lead to greater use and application of research results by patients, by stakeholders, and several other professionals within the healthcare community. Next slide, please. So why involve people with lived experience? To capture the essence of this, we thought it best to include some quotes from individuals that we have worked with who do have lived experience. So to read a few off the screen for you, why involve people with lived experience of brain injury? Because those of us with lived experience have experienced the gaps and can support the development of solutions to fill those gaps. Because a person who lives with TBI can be your best resource. It is important that survivors have a voice and a seat at the table. Next slide, please. So moving into how we got people to engage with our work and into our recruitment. So what we did was we reached out to networks of people with lived experience through organizations and associations that we've worked with, and we sent them a survey developed to address their accessibility needs and to identify their interest in participation. And all interested participants were offered several different methods of participation based on their comfort and their preference. So examples included expert panel participation, completion of feedback surveys, one-on-one interviews, as well as focus groups. Next slide, please. So this is just a summary of how we engaged individuals. And through all those methods, we received feedback, which we used to improve our individuals with lived experience resources, as well as our caregiver resources. So what we did was we updated the content. We included more diagrams, pictures, and infographics. We included strategies on resource navigation. And then we also included links to brain injury associations for specific details and support. So not only did we want to provide those strategies on how to use resources and how to navigate them, but we also wanted to include links to where they can find specific resources and support. What we also did was we developed 3 new recommendations to be a part of our clinical practice guideline. And these address the need for ongoing therapy when transitioning into the community. And we also emphasize that recovery occurs throughout the life, and it can occur long after one sustains an injury. So there is a possibility of continually making gains over a period of months and years, and rehabilitation doesn't stop after moving out of a formal setting. Next slide, please. So in a similar way, we also engaged family, friends, and caregivers because their voices are also important and their experiences also need to be highlighted. And through this, we were able to identify priority gaps in the system, as well as new recommendations. So to summarize some of that content on the screen, we heard that there's a need to elevate the voice of family members, caregivers, and friends. There's a need to improve the availability, awareness, and training of personal support workers. There's a need to improve access to community resources. So this is for individuals with lived experience, as well as their caregivers, family, and friends, and also to improve access to mental health support for all of these individuals. Next slide, please. So the key takeaways from all of those forms of engagement were that there needs to be more education and training for clinicians to stay up to date on how to address brain injury, accurately identify symptoms, and interact with patients respectfully. So we heard that workshops need to be led by individuals who have sustained a brain injury to better understand their needs and experiences. So we don't always want to be hearing from researchers or healthcare professionals. We also want to see people with lived experience be a part of those workshops and those trainings. We also heard that baseline training in active listening, empathy, and removing biases or assumptions about brain injury are important across all care stages. And also that people with lived experience should be included meaningfully in research, clinical facilities, and in helping raise awareness. They shouldn't be added to a committee just to check off a box. So what we're hearing is that they need to feel heard and they need to be involved in a meaningful manner when they are being a part of research or any sort of clinical facility. Next slide, please. A few more key takeaways. We heard that everything should be documented and shared with individuals in multiple formats, aside from in-person explanations. So written handouts, emails, online portals, and so on. And privacy and security considerations should be made when sharing medical records and details. We also heard that clinicians should be made aware of support services, encouraged to disseminate this information, and to make appropriate and timely referrals. And also individuals should have periodic follow-up meetings where they are encouraged to ask questions, especially when they are transitioning into the community, because we see a significant gap once an individual leaves formal rehabilitation and is transitioning into the community. Next slide, please. Next. So what we did with all of that feedback and all of that information is that we integrated it into our resources. And I will speak to each one of them individually in the next few slides. But first, we updated our standards of care. Next. We also updated our patient handbook. And next. We also created a short infographic to summarize everything that you find in the patient handbook. Next slide, please. Next. So to talk about the standards of care specifically, what we did was we had individuals with lived experience give us feedback on the existing standards of care and revised it and updated it. So essentially it outlines what an individual can expect from the healthcare system after they have sustained a TBI, and also what a caregiver or a family member's rights and responsibilities are during this time. Next. So the first one speaks about interprofessional rehab team. The second one, next, speaks about comprehensive assessment. The third one speaks about goal setting and monitoring. The next one talks about care coordination. And then we have mental health, substance use, and behavioral supports as needed. And we also have, we've also highlighted follow-up care. Next, next. And the last page of this document talks about a caregiver's expectations and responsibilities of an individual's care. So we ensured to tie in that piece and that involvement of family members and caregivers through this process, as they might have several expectations as well as responsibilities from an individual's care. Next slide, please. Next. Here we have the patient handbook, which is an overview of the entire rehabilitation system. So we wanted to use it as a guide for an individual to understand what they can expect when they begin the rehabilitation process. And it's about 15 pages long. Next. So this is just an example of one of the pages where you can see things like what is traumatic brain injury, what is the role of rehabilitation, and also what they can expect from the rehabilitation team. So all of this information is for them to understand what they are entering and what they're getting into. Next. And over here, you can see we highlight some quick tips as well. So some actionable items that an individual can use and apply in their daily lives. And we also have some helpful resources included. Next. Next. So here we have a breakdown of our infographic. Next. Next. Sorry, a lot of animations there, but all of this shows you our infographic, which is a summary of the patient handbook. So we recognize that the patient handbook, it's long, it's 15 pages, it has a lot of text, and not every individual might be able or ready to go through something that is that text heavy and that long. So what we wanted to do was create a short version of that where you can find the most important points, maybe like a key takeaway sheet, and then have some important resources as well. So an individual can start by maybe scanning through this and reading this, and then moving to the handbook when they feel ready or find it necessary to do so. So that was the purpose behind us creating this infographic. And all of these resources I will be sharing with all of you today. We are in the process of uploading it to our website, but I will also share PDFs at the end of the talk with everybody in case you'd like to use it or share it with anybody. Next slide, please. So just to break the flow a little bit again and get everybody engaged, I have another question for you. So who do you think should be looking at the guideline content and Pathways websites? So there are probably a lot of right answers. There is no right or wrong answer here, but just to get you thinking of who do you think should be looking at this content? Feel free to drop some answers in the chat if you have some guesses. Okay, next slide, please. So there are lots of people who need to be a part of this discussion and see this content. And so we wanted to engage other stakeholders as well. So apart from, clinicians and healthcare professionals and individuals with lived experience, we thought it necessary to engage with insurance companies as well as lawyers, because a lot of individuals who have sustained a TBI have to be interacting with these individuals. So it's important that the expectations of care and care plans are not only read by individuals with lived experience and their clinicians, but also these other stakeholders. So firstly, we engaged with the Workplace Safety and Insurance Board, and we were hearing that it's challenging for individuals with lived experience and their family and caregivers to interact with insurance boards. And so we thought it necessary to engage with WSIB. And so what we did was we had several consultation meetings with high-level representatives from WSIB, and we hear that the care plans that they use are consistent with the ideal care pathways, so that pathway that I showed you right at the beginning, but they do require some adaptations, especially in the area of integrating publicly funded community-based care. So what we're seeing is there just needs to be more alignment with the care plans that WSIB uses with the ideal care pathways that we've developed. Next slide, please. We also engaged with the Insurance Bureau of Canada, so IBC, and the challenges are similar to that which we heard of when we were talking about WSIB. And what we did was we had focus groups with insurance adjusters from all major motor vehicle insurance companies, and also several consultation meetings with high-level representatives. Once again, there was support for the ideal care pathways to help adjusters understand the care that is needed for brain injury. And what we are doing is we are circulating some of the drafts of resources and tools that we have created in order to support their work. And we are going back and forth to get feedback and make sure that it is appropriate in addressing things like diagnosis criteria, treatment plan recommendations, and so on. Next slide, please. And thirdly, we also engaged with the Ontario Trial Lawyers Association, so OTLA. And what we did was we had focus groups with personal injury lawyers and high-level representatives from OTLA. And once again, there was support for the ideal care pathways to help lawyers understand the necessary care for brain injury in the early stages, as well as across the lifespan. And we're in the process of having ongoing discussions with OTLA to understand how to communicate the necessary resources, treatments, care timelines, and long-term support that individuals who have sustained a TBI require. Next slide, please. So to pull all of that together, the purpose of engaging our key partners is as follows. awareness of the ideal care pathways, and collecting and sharing data about individuals who access services through third-party providers such as IVC and WSIB can lead to a better understanding of access to third-party resources. So anything that isn't funded by OHIP or covered by OHIP. It helps us identify where the inequities lie in the system, and it also highlights the gaps within the system. So the collection and sharing of this kind of data is very important for all of these purposes. This can also help us establish data linkages between public and third-party care over time, which can improve data integration for neurotrauma care in the community. So once again, highlighting that importance of collecting and sharing data related to publicly funded as well as third-party funded care. Next slide, please. So some key takeaways. We hear that individuals with lived experience of brain injury emphasize their enthusiasm to be involved in system-level rehabilitation research to improve the outcomes for their peers, for their community. So because of this, individuals should be involved in systems-level rehabilitation research, as lived experience provides a unique and necessary perspective to identify gaps in the system that may be difficult for clinicians or researchers to identify. And thirdly, collaboration with key partners can improve current data and care models for brain injury. Next slide, please. So I have one more question for all of you. I promise it's the last one. But what percentage of moderate to severe traumatic brain injuries occur in individuals 65 and older? So what percentage of everybody who sustains a traumatic brain injury is over the age of 65? If you have any guesses, once again, please drop them in the chat. Okay, next slide, please. So it's 64.7%, which is over half of all individuals who sustain a traumatic brain injury or moderate to severe traumatic brain injury are over the age of 65 or 65 years old. And so this tells us that there needs to be specialized TBI services to support newly diagnosed older adults, as well as people who are aging with a traumatic brain injury. So there needs to be more research and more focus into that component of aging and how it interacts with an individual's traumatic brain injury. Next slide, please. So this takes us into the next steps. So what are we doing moving forward as a team? So the goal is to refine the new website that I will talk about in a second, and our implementation tools and resources to improve the end user experience as a whole. As part of the Pathways project, we are also engaging more individuals with lived experience and their caregivers and family members in working groups to develop the pathways of care, as well as the implementation priorities. And the broader goal is to gather feedback from a diverse set of stakeholders to improve the guideline, its resources, and implementation. So as I mentioned, we're also hoping to involve older adults and investigate TBI in older individuals. We're also working with registered health professions and connecting with their colleges and associations to engage in their outreach initiatives and conferences. So we want to make sure that all of this information is reaching clinicians, so reaching nurses, physicians, nurse practitioners, occupational therapists, anyone that might be involved in an individual's care after they have sustained a brain injury. We want to make sure that this information is reaching them. So that's why we're connecting with those registered health professionals. We're also connecting with brain injury organizations, such as at today's event, where we're hoping to reach community members, individuals with lived experience, their family, and their caregivers. So presentations such as this one is done with the purpose of sharing this information with community members. So we hope to continue doing that, having more presentations, providing information in newsletters, webinars, and also recruiting more individuals moving forward as we continue doing more research and engaging more people with lived experience. Next slide, please. And before I wrap it up, I want to talk a little bit about the role of equity and inclusion in the kind of work that we do. So something to acknowledge as an area of improvement is the inclusion of individuals with diverse identities. So gender identity, individuals of different sexes, people with different cultural backgrounds, different ethnicities, and so on. So although we reached out to individuals through several different research networks, it must be noted that individuals who volunteer to participate in this kind of work often belong to certain identity groups, groups that may have better access to healthcare resources, and people who may have faced less historical discrimination. So there is an element of trust that needs to be established between researchers and healthcare workers with these individuals with lived experience who might also be part of a minority group, because not only would they have possibly faced discrimination due to their injury, but they might also face other forms of discrimination, which prevents them from trusting healthcare workers and researchers. So that's something that all of us collectively need to work towards to form better trusting relationships. And this will help us engage more and more individuals with diverse identities to give us a better picture of what the population looks like and give us a wide array of feedback. So as a start, we engaged the individuals who we've already worked with, and we had a discussion with them to brainstorm some recruitment strategies and to note their thoughts on how we might be able to build trust within their communities and with their peers, because they could be our best resource in that aspect. And so these individuals and community partners are integral to recruiting more individuals with diverse identities in the future. And so to thank these individuals for taking the time to participate in these initiatives and for engaging in our work, we also provided honorariums. Next slide, please. And that brings us almost to the end of our presentation, but I would also like to let all of you know that we have new websites, both for the Canadian TBI Guideline as well as for the Neurotrauma Care Pathways Project. I will drop the link in the chat in one moment, but in the meantime, I will talk about it. So there's a QR code there if you are able to scan it, but I will also send the link in the chat. Feel free to go and read about all of the recommendations that we have there for clinicians and healthcare workers, but to also access the people with lived experience resources and the caregiver and family member resources. And next slide, please. Similarly, as I mentioned, we have the new website for the Neurotrauma Care Pathways Project. And here we have all those ideal care pathways that I showed you at the beginning. And it's interactive, so you're able to click on the different boxes and it tells you more about each of those boxes, about that care, about those services, and any associated tools and resources. So it's easy to navigate, and it's good to get an understanding of what the care pathways look like and what the different stages of care look like, and what different resources are available. Next slide, please. And with that, I would like to thank all of you for listening to me and attending today's session. I would also like to thank the Brain Injury Association of York Region for inviting me and for letting me talk about the work that our team is engaged with. If you have any questions at all after this meeting, please feel free to email me or my supervisor, Judy Gargaro. We'd be very happy to answer any questions and to also provide you with any of the resources that I might have mentioned today. And with that, I will hand it back. And I think we have time for some live questions and also to address the questions in the chat. But thank you so much.